Today's video is on testosterone. Should you try to increase your testosterone levels naturally with lifestyle modifications, or should you go ahead and start on testosterone replacement therapy? I am holding my little pup here because it is storming and she hates it, so hopefully she stops shaking here soon. So I want to preface this with a couple things first. Testosterone is actually a hormone that is in both men and women. Important for both. Testosterone replacement can be used for both men and women. Most of this video can be applied to both, but typically I see a lot more testosterone replacement in men. But again, this can be applied to both men and women. Now, this is also talking about testosterone replacement to optimize your levels. So this is not going to be in regards to super physiological levels that is used in bodybuilders. Again, a lot of this could be applied to bodybuilders or people that take testosterone at super physiological levels, but I am speaking mostly on replacing testosterone to get to those optimal levels. So what are those optimal levels? When you get your testosterone checked on lab work, you are seeing a reference range, and this reference range is based off of our population, which we know is not very healthy. So just because you're within the reference range does not mean you're optimal as far as your testosterone level. The reference range, depending on the lab, is going to be somewhere between I believe it's 260 to 900 something. If you are within the reference range and you are 200, 300, definitely not ideal, definitely not going to be feeling great. And that is the reference range for men. Now for women, it's going to look like the reference range somewhere between, depends again on the lab, but 5 to 10 up to about 50. Again, just because you're within that reference range does not mean you're optimal. What is going to be more optimal for men is going to be for sure over 500. This slightly, depends on your age too, but for most people, they're going to feel more optimal when they're closer to that 7, 8, 900, even 1,000 mark. And then for women, even being outside of that reference range, so testosterone levels closer to 60 or 80, even up to 100, will typically have women feeling more optimal. Now, some other things to consider with lab work is that you probably don't want to be testing just total testosterone if you're trying to get a full comprehensive panel and look at your hormones. Someone could have a normal testosterone level. I've seen people with total testosterone level 600, 700, but then we check their free testosterone and it is much, much lower. So what does this mean? Free versus total. Total is the total amount of testosterone that you have in your body, but some of that testosterone is going to be bound. So what that means is that bound testosterone is not necessarily active. The free testosterone is measuring the actual active testosterone that is not bound. So just because you have a normal testosterone level, you may not have enough active testosterone. So it could be helpful for a lot of people to have both of those numbers checked. Other super helpful labs that you're going to want to get if you're considering testosterone replacement is checking your estrogen. Testosterone will aromatize to estrogen. It will convert to estrogen. And every single person is different at the rate it will do this. So some people will convert a lot of their testosterone to estrogen and potentially have side effects of that. So monitoring your testosterone with your estrogen is absolutely vital. If you are starting on testosterone replacement therapy, your estrogen can increase as well. So you may need to be on a medication that would prevent your estrogen from rising too high. So basically you have testosterone, it aromatizes to estrogen. And what that medication is called a aromatase inhibitor. So it stops that conversion. Again, not everyone needs to be on a aromatase inhibitor, or we often call it an AI, estrogen blocker, a lot of different names for it, most common one being anastrozole. Not everyone will need to be on it if their testosterone is not converting at a high level to estrogen, but if it is, which happens in a lot of people, you would need to be on an AI. So back to the original question, would I recommend lifestyle changes to try to increase your testosterone or actually supplementing with testosterone with hormone replacement? Like everything in medicine, this kind of depends on the person. I would say for most people, obviously you want to be optimizing your lifestyle regardless. Let's have two different scenarios here. We're looking at a patient that drinks alcohol regularly, daily, binge drinks on the weekend. Diet is terrible. They eat out all the time. They're eating low protein diet, high fat, high carbohydrate. They're overweight. Their stress is super high. Their sleep is terrible. For that person, I'm probably going to recommend that they work on their lifestyle first, optimize that for a couple months. So again, cutting out alcohol for the most part. Alcohol is more or less terrible for your hormones, especially testosterone. Optimizing diet. Resistance training can help increase your testosterone levels, so hard weight training. Optimizing sleep and stress. Now, if this person does all of this and their testosterone is still low or lower than that 500 mark, or their free testosterone is still low, they would probably be a good candidate for hormone replacement, testosterone replacement. Now, say on the other hand, you have a patient that is already optimized. They are working out, they have an incredible diet, their sleep is good, their stress is good, but they just don't feel great. They're fatigued, they have low libido, their energy is not there, their motivation is not there, they have sexual dysfunction or erectile dysfunction. This person probably off the bat would be a good candidate for hormone replacement. Now, the other thing to consider is people worry that testosterone is going to be bad for their health. Again, this comes back to how you're dosing it. If you are within optimal ranges, the studies actually show that hormone replacement can improve your health. It can reverse metabolic syndrome, and it can actually improve your cholesterol levels in some people, and it can improve insulin resistance. So going back to that first patient, super terrible lifestyle, drinking alcohol, terrible diet, not exercising. Again, this person needs to make the changes. They need to make the lifestyle modification. Once they start doing that, starting them on testosterone replacement could actually improve their health markers. Again, this is not super physiological. This is not bodybuilding levels. This is just optimal levels. The other question is, does testosterone cause cancer or prostate cancer? And majority of the newer studies are showing that no, it does not. If you already have prostate cancer, you should probably not be on testosterone replacement at this time unless you're cleared by your urologist and your cancer doctor. But it does not cause cancer in patients that do not already have cancer. So just to recap, what are ways to increase your testosterone levels naturally? That's going to be cutting out alcohol, resistance training hard, getting actual muscle mass on your body, optimizing your diet, high protein diet, losing weight if you're overweight, especially if you carry too much body fat in the midsection, reducing stress and getting adequate amount of sleep. Those are the main ones. Again, it's the same lifestyle changes that I recommend for everybody, but that is what's going to optimize your hormones across the board. This is for men and women. Now, starting on hormone replacement therapy, testosterone replacement therapy, how does it actually improve your health? You are going to be doing a lot of those things, lifestyle changes, but when you have the assistance of testosterone, you will be able to put on more muscle mass and reduce your body fat even more effectively. You're going to have a lot more energy. That means you'll be able to be more successful in the gym. You will be more productive throughout the day. And then hopefully that means you're sleeping better as well. So how am I going to recommend testosterone for a patient? I'm always going to recommend that you start on testosterone replacement therapy via injections. So there are different formulations. There's an oral form, definitely not going to recommend that, especially for men. Testosterone creams, also not going to recommend that. It is very hard to dose cream. It's literally messy. It's a cream that you're putting on your body. But the other main issue with that is it can rub off onto other people. So there's plenty of reports of spouses or children getting testosterone from the dad that is on testosterone replacement cream. And obviously that is not ideal. We want the prescription to go to the person that it is prescribed for, not transferred to children or wives. Although the wives may benefit from it partially too, but they should be on their own testosterone replacement, not transferable cream from the husband. Pellets is another form. Don't really recommend pellets for most people because they are very hard to alter the dose once they are placed. Pellets being literally just a little pellet that's inserted under the skin. A lot of times it's put in the glute. But once that is placed, it's hard to alter it. With injections, you can very easily increase, decrease the dose depending on what the patient needs. So just as a summary, am I going to recommend testosterone replacement or lifestyle changes? And the simple answer is both. You want to be optimizing your lifestyle as much as possible, but testosterone replacement can get you to your goals a lot faster. It can get you healthier faster because you are putting on more muscle mass, losing body fat, and it can actually improve your health by reversing metabolic syndrome, improving cholesterol, and reversing insulin resistance if you are doing all these things correctly. If you are optimizing your testosterone optimization ranges, you are not super physiological, but you are in healthy ranges and you are doing lifestyle modification. For most people, hormone replacement is going to be a win. So if you need a way to do both of these things, you want to improve your lifestyle, you want to get into the gym, start working hard, you want to work on your diet, but you also want to optimize your hormones, our team can do all of that. We can do hormone replacement, we can check your lab work, review your lab work, we can set you up for an optimal exercise program and a diet plan for you. So if you want a one-stop shop, all-inclusive care to get all of that done and optimize your hormones and your body, check us out at TCY Coaching or send me a message for further information. Winnie says everyone deserves to have optimal hormones and feel good and look good every single day. Right, Winnie? Mm-hmm.